This is Dr. Solomon from Buea. How is everyone this evening? I'm glad to be here in Buea, broadcasting this session. Today is my first session, so we will do a bit of introduction. I will be here every Thursday, 4:30 to almost 5:30. Every Thursday, 4:30 to 5:30. I guess most of you out there know me, and we will be discussing some issues that are most relevant to most of you out there, the things that repeat the most and what I see the most in the clinic. We will start with something that everybody is concerned about, almost everybody is concerned about, which is infertility issue and woman health. We're talking about the reproductive system of the female. When we say infertility, that takes a man and a woman. We'll start with the woman, since ladies are always first. So today will only be half an hour. This is just a small introduction, and hopefully by next Thursday you will have your your questions, any concern that is regards to infertility, you have it ready, and my WhatsApp number will be there played on the screen, and you can text me the messages of any questions or concern, and I'll be more than happy to answer them. Well, we will start the first with the vagina. We know that in order for us to have a baby, we have to have sperms that are good in number, more than 20 million, and we have to have those sperms with good function. They cannot be deformed. What are we looking for in a sperm? We're looking for enough number, and we're looking for good functionality. The functionality is summarized in two things. The sperms is asked to do two things only. First is to swim, being able to have enough energy to get all the way to the egg at the end of the fallopian tube. And second is ability to penetrate this egg, and at that moment we will have a fertilized egg. We will discuss this later. So let's discuss first about the vagina. This is the first stop where the sperm will go. So the first stop is the vagina must be suitable to accommodate the sperm. When I say suitable, meaning is not too acidic, it is not too alkaline, what we call the pH. pH, maybe you do not need to know much about medical terms or chemical terms. Basically, the vagina should be free from any diseases, overload of bacteria, or any parasites that may be harmful to that sperm. What are the most common complaints that we get about vagina? The most common complaint that we get day on and day out is vaginal discharge, vaginal itching. Normally, the vagina should not be itching, and normally we should not have any discharge from the vagina. This is normal scenarios. What if there is discharge? Then the pH, which is the environment where the sperm will first be, will be not suitable, will be too acidic, because those bacteria, they eat, they drink, and they produce lactic acid, what is called lactic acid as a waste product, and that increases the pH. Increases the pH, meaning the number will be lower, and that kills the sperms, or most of the sperms. Remember, we can have up to 300 million of the sperms. Not all of them will die, but we will remain with very little, and the chances are very less that that sperm can swim and make it all the way to the egg. So the first thing is the vagina. The vagina has to be suitable for the sperm to function and go through the first gate, which in this case the cervix. Maybe we will have time to discuss the cervix today, and maybe not. But let's stop first at the first stop, which is the vagina. As I said, the most common complaint is vaginal discharge, vaginal itching. In most cases, they are together. So what will make the vagina to itch and have discharge? Number one, something called trichomonas. How would you know? Don't worry about the names. How would you know you have something wrong? You will have discharge from the vagina. The color sometimes is disturbing, meaning you will not really put your hand on a color and say for sure is yellowish or whitish or brownish. You will not be able to, because among the secretion maybe you're spotting and one drop of blood will mess up the color. But sometimes it is clear. So if we're talking about trichomonas, the distinct odor will tell you. The distinct odor will tell you. So it's offensive odor. That means we have trichomonas in our hand. Very small, simple test. Under the microscope, we will see some organism swimming, movement. There is some motility. Then we will know we have trichomonas in our hand. Now, the treatment is quite easy. We give local treatment that will be inserted into the vagina. We give also systemic treatment that will be taken by mouth. Now, remember that trichomonas, in case you didn't know, and this is most of the mistakes that has been done, is you go there, you complain, you get tested, you get the diagnosis, you take the treatment, everything is okay. But you go to your sexual partner, have sex, and few days or weeks later, you have the same issue again. What happened? What happened is trichomonas is sexually transmitted. So if you get that itching, your sexual partner is not off the hook. He also has to be treated. Now, what kind of other discharge can we have? We can have most commonly that white, very white, cheesy discharge. That is most likely bacterial vaginosis. That also require a bit of treatment, but is not sexually transmitted. We can have candida, and in this case, it will be burning. The vagina will be like burning, okay? And if you look at your vagina, even with a mirror, and you can see inside, it will be like a strawberry red, very red. So that is something else. That's another scenario, candida, that is can also be easily treated. So we talk about vaginosis, bacterial vaginosis, we're talking about trichomoniasis, we're talking about candida. Those are all three things that can most commonly cause itching in the vagina. The treatment vary from one to another. The one that is sexually transmitted and both partners must be treated is the trichomoniasis, and you can easily recognize trichomoniasis by the offensive smell. The bacterial vaginosis don't have a smell. The candida most likely do not have a smell. Can we get a combined infection that has a little bit of candida, a little bit of vaginosis, bacterial vaginosis, and a little bit of trichomoniasis? Yes, we can have. So now, that are the things that causes a little bit of itching and a little bit of discharge and discomfort. You cannot have a very pleasant relationship, sexual relationship, when those small things are there. So it's easily treated. We recognize what is there. The treatment is quite easy. In case of trichomoniasis, the partner must also take the treatment, and you're okay. So if we have a sperm at that moment in the vagina, the sperm will not survive, because the pH of the vagina has changed. The environment is no longer suitable for the sperm to survive. So that's easy, simple recognition of the fact that the vagina has to be clean. It could be one simple cause of infertility that can be easily eliminated. very easily eliminated. So now, what else can we see in the vagina? I get a lot of complaints, doc, I have like a growth in the wall of the vagina. When I insert my finger, there is like a ball there in either side, left or right. And I say, do not panic. It is not a problem. This is just, you know, the vagina has glands, and those glands are responsible to secrete some lubrication in the vagina. It's coming from those glands that are on both sides of the vagina. So sometimes the gland duct, so the gland has to have a duct to secrete the mucus and the lubrication into the vagina. Sometimes it gets clogged, and the mucus and the secretion accumulate inside. There's no way out, so they cause, you know, a little bit of swelling, and it's sometimes painful, because when things swell, nerves get compressed, and this is how you have the pain. So if it happened at the beginning, and believe me, you will notice, you do not need to panic. You just insert your finger and go in a circular motion, clockwise or unclockwise, it doesn't matter, smooth, with a small warm oil, and you go in a circular motion. If the obstruction is not too bad, then it will be relieved and is no problem. But sometimes you ignore it and you don't know what to do, and things get a bit complicated, and then that small ball or a cyst, now that the fluid cannot get out, and the vagina has microbes, normal flora there, some of it enter inside, and now things get infected, and now we have almost like an abscess. So in this case, since you ignored it, you didn't drain it with your circular motion by the hand in the beginning, it can develop into a small abscess. And that is also nothing big to worry about. We will drain the abscess sometime with a needle, with a spray, and then, you know, we give small antibiotics, and things will be fine. So those are the things that are normally and easily you can look out for and can be easily treated. And that is the first thing, you know, that can stand as an obstacle, easy to fix obstacle in the way of infertility. You do not need to think big terms, IVF, IUI, you know, those big things that cost a lot of money and is a bit invasive, when you have not worked on a small issue. Meaning, you have to be 100% ready before you think about what is the next step. I should, I'm panicking. I cannot have a baby, and I know the culture stress and everything is dumped on the head of the woman, because especially from the family of the husband. Has been a year, we have no baby. Has been 2 years, we have no baby. Has been 3 years. This is all stress that land on the top of the head of the female, of the wife. And believe it or not, when you stress the woman too much, she cannot ovulate. When you stress too much, you cannot ovulate. So when you nag and you stress her out unnecessarily, she will not be able to ovulate. And the etiology, the cause for no ovulation is you. Because you have to understand the fact that when you stress too much, ovulation is inhibited. You cannot ovulate. Okay? So this is something that we should keep in mind. So now the vagina is taken care of. The vagina is ready to accommodate. It has been fixed. We're going to go to the second gate. The second gate is the cervix, something called the cervix, which is the mouth of the uterus. This is the gate to the enter the uterus from the vagina, is the cervix. During ovulation, and let me stop at ovulation. Most of us out there do not know how to calculate ovulation. It is very easy to calculate. Let me tell you, very easy. When you get your menses, and it does not matter how long is your cycle, whether it's 21 days, 28 days, 31 days, a year, 2 years, it doesn't matter. The first day you get your cycle, you say, this is day number 1. So the first day of the menses is day number 1. And then you count 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. That 14th day is your day of ovulation. And it's always the case. If you are human, the 14th day is the day of ovulation. So when is the best window of opportunity to get pregnant? Day 13, which is 1 day before the ovulation. Day 14, which is the day of ovulation. And day 15, which is 1 day after the ovulation. Why 3 days? Because the sperm can survive 48 hours. The egg can survive 72 hours. That's why we say 3 days. Day 14 ovulation day, 1 day before and 1 day after. That is your ovulation time. And that is the time when you should have sex. Assuming everything is okay. When you have sex, the woman should lay on her back or in whatever position where you allow the ease of swimming of the sperms all the way to the eggs in the fimbria by the end of the fallopian tube. So do not get up for at least 15 minutes. Do not get up for at least 15 minutes. Now, what are the problems that we see there? Now this is in general, we just stopped at the word ovulation because I want you to know how to correctly calculate your ovulation day. Now, what will be the next step? What can be wrong at that gate? The cervix, what can be wrong at that gate? Normally, on the ovulation day, the cervix gets softer. The cervix is like a gate, like I say, and it has a canal that leads to the uterus. This canal, cervical canal, usually it has a thick mucus, like a blood, so nothing can get into the uterus in non-ovulating days. So only on ovulation day, physiology of that uterus, the cervix change, become a bit softer, and the canal become the liquid inside, or the mucus inside, that thick mucus turn into almost watery. Why? To allow the passage of that sperm. So this is the normal condition. That is, if the cervix is good, the mucus becomes watery at ovulation to allow the passage. Can things go wrong? Yes, things can go wrong. What if that canal is still clogged? That means the sperms will only be inside the vagina. They try to enter the gate at the os, or the mouth of the cervix, and inside the canal there is a thick mucus that is clogged. We cannot get through. So this is one of the problems. We do a very simple test. We take a sample of that, from that mucus in the cervix, and we evaluate, is the problem at the level of the mucus or not? If there is a problem, we fix the problem. There are medication and there are procedures we make whereby there is the ease of the sperms getting all the way to the egg is a possibility. There are some times when we have a little bit of stenosis, meaning we've been having inflammation for a long time and things become hard and difficult to fix, and the cervix canal is clogged or blocked, and there is no way for any sperm to go through. There is a test called histosalpingogram that evaluate the canal evaluate the tubes, evaluate the uterus for us. There is also something called ultrasound, new versions of the ultrasound. I can easily say and see the uterus, the tubes, the ovaries, and the cervical canal if there is any cloggage or any inflammation, chronic inflammation that caused stenosis. Stenosis means narrowing of that canal to the extent that it is almost clogged and nothing can pass through. If this is the case, we correct, and we have a procedure called IUI, intrauterine insemination, IUI, whereby we can insert a very small catheter. We bypass that stenosis or clog or block. We shoot the sperms in a syringe through the canal, through that catheter. We push the catheter all the way, guided by an ultrasound, so you know exactly where we're going, and then we shoot the sperms very close to the egg, and that we call assisted, fertilization. We assist you to get the sperm there. When we do this procedure, the IUI, when there is a problem of, in general, in simple English, the sperm cannot get to the egg, so we're assisting the sperm to get to the egg. Or we have a male with oligospermia, very low count of sperms, and we know we need millions, at least, above 20 millions, to have a chance to fertilize. So this man will not be able to get to the egg, so we assist. We take the sperms, we wash the sperms. It's not like we're going to wash the sperms with water, just a medical term. We centrifuge, we extract the sperms, we put them in a syringe, we put the catheter inside the vagina, through the cervix, through the uterus, all the way to the end of the uterus, and we shoot as close to the fallopian tube as possible. So this is the cervix and what problems we could have with the cervix. Now, what can most commonly causes problem to the cervix? Any sexually transmitted disease can cause a problem to the cervix. Most commonly, something called HPV, which is human papilloma virus, HPV. All women should, age 18 and above, whether they have sex or they don't have sex, they should be evaluated for HPV, because there's only one cancer that can happen to the cervix and is induced by HPV, human papilloma virus. So that's what we need to evaluate the cervix. Routinely, you should make an examination where the doctor can look at the cervix and see if there is any lesions there or not. The evidence that tells you it's time to go to the doctor is when you have sex and you notice spotting. There is 1 or 2 drops of blood after you have sex. That means the cervix is fragile and friction with the penis had caused a small bleeding to happen. So this is not to be taken lightly. You should go and see your doctor, and the doctor will look at and will tell you, you have a lesion, you don't have a lesion, and you do evaluation. There is another version of complication or problems that happen to the cervix called cervical polyps. It's a growth that comes in the way of the canal and block the cervix. That it can also be easily removed, 5-10 minutes procedure, by heat, by a machine that produces a lot of heat, like laser, and we take it off, snap it off, and that's it, end of story. It depends now on the location of the polyp, what is going to be an easy procedure or a bit more difficult procedure. But anyhow, we clean the vagina. There is no itching, there is no infection in the vagina, everything is good, and there are ovules that you insert and we'll take care of all that locally. There is no STDs. We did the screening for most likely chlamydia, venereal diseases, and all sexually transmitted diseases, and we know that we are clean. We investigated the cervix, and we know the cervix is open and the canal is patent, meaning no blockage, and the liquid in size is almost watery to allow the passage of the sperms, then we are at number 2 station. Success, we have succeeded station number 1, the vagina. We are at station number 2, the cervix, and we evaluated the cervix, and the cervix has no problem. And the number of sperms are fine, the function of the sperms are fine. Now the sperms are inside the uterus. What the uterus does to receive the sperms, it contracts small to facilitate the movement of the sperm to make it to the next station, which is the fallopian tube. Now, this is a good uterus. Now, can we have a problem with the uterus? Yes. If the uterus is myomatous, meaning there is fibroma, there is growth, there is hard fibers that is forming inside the uterus, in the walls of the uterus, that will be difficult then. You can get pregnant because the endometrium is clear. You can get pregnant. But now, after you get pregnant, what happened? The uterus need to expand. So if I expand, and those things, those growth we call fibromas, are like solid balls. So the elasticity of the uterus has been lost. I cannot expand anymore. So what happened to the pregnancy? Drop. And you see it as clots. You see it as heavy clots. And that means you should be evaluated. Why did I drop the pregnancy? There are infections that cause also the pregnancy to drop, like toxoplasmosis. All labs in Buea do toxoplasmosis, so there is no reason for you to stay. If you have a miscarriage once, there's no reason for you to stay home and not get evaluated. So now, those are the problems that can happen with the uterus. The uterus is the home of the baby. The home of the baby should have the capacity to enlarge and accommodate the pregnancy. If I lost this capacity, elastic capacity to enlarge and accommodate the baby, obviously I have a problem. So I should be checking for fibroids. When should I do all this? Before I get pregnant. You're not gonna wait till you get pregnant and drop the pregnancy and go investigate what happened. You wanna get pregnant, you should be evaluated. So we do not lose time and we do not go into complication unnecessarily. Why? Because you can have what is called ectopic pregnancy. And now we're going to move to the tubes, to the fallopian tubes. I have 2 or 3 minutes left. The fallopian tube have something like projections, like hairs, very small hair. It's like fimbria. It's like not fimbria, it's like hair, like a small projection. To ease it beats, so it eases the movement and the swimming of the sperm to get to the egg. Once the sperm get to the egg, not only one sperm will make it, maybe 10,000 will make it, but only one will make it to the egg, and that is the winning sperm. Once it gets to the egg, it will adhere to the surface of the egg, it will penetrate the egg, and it will produce a chemical to surround the egg and prevent every other sperm to enter. So it's just one sperm. What if I want twins? That means it has to be 2 eggs. 1 sperm, 1 egg. Now the egg gets fertilized, it divides, and it moves back to the uterus where it will implant. And then on day 9, when it implants between day 7 to day 9, about that, then the zygote, that small baby, starts to dig in the wall of the uterus looking for food. The food here is the blood vessel, which later on will form the placenta. It digs, it digs, it digs. So that is why you see maybe 1 or 2 drops of blood. It's not to be scared of. This is just the baby digging, looking for a blood vessel so it can feed on. Once this happens, then the vessel, things will form, and a hormone called beta-HCG will be induced into the blood. And this is when you do the pregnancy test and it come out positive. Why? Because the baby, that zygote, has digged into the wall of the uterus, made it to the blood, and beta-HCG, which is as a result of the pregnancy, now in the blood to urine, and now we can do by the pregnancy test and see it. So when can we see the pregnancy test positive? In day 9. Day 9, day 11, day 9 to 11. This is when we see when we see the pregnancy positive. Which one is more accurate, blood or urine? Very much the same, but blood is a bit more accurate because you see it more earlier, because the beta HCG make it to the blood first, and then when it's increased a bit in number, it spills over in the urine, and now we see it in the urine. This is in summary, the fertility process. I wanted to say that we will talk about infertility for few sessions. I have a lot of questions from before, because I am also a health coordinator for another TV program. I welcome all your questions and concerns. Have them ready for next Thursday, 4:30 to 5:30. 4:30 to almost 5:30. My WhatsApp will be played on the screen. And at last, I want to say I'm very happy to be in Buea. I didn't even know that such beautiful TV program exists. I was very excited to know. And I'm here to share with you and educate you about simple stuff that if you know, you would be easily, you easily can avoid, and the outcome should be much, much better. This is Dr. Solomon with you this evening, and I will look forward to see you next Thursday, again, 4:30 to 5:30. May God bless you all, and you have a wonderful and beautiful evening. Thank you.